Yes, it starts.
A very warm good afternoon to everybody. Namaskar from the entire family of Dabur India Limited. I, Anuj Kumar, welcome all the Vaidyas, doctors, channel partners, and everybody who have joined us for this important webinar. We at Dabur firmly believe that knowledge is an important tool in the addressing healthcare as a concern. So, in that context, the webinar series by Dr. Kohli, I think, would have helped many of the budding doctors, especially the Ayurveda doctors and the allopathic doctors, to kind of get a holistic understanding on the various topics on which we have been doing webinars. And Dr. Kohli is, well, he doesn't need an introduction as of now. He has been very famous. Dr. Kohli is a renowned cardiologist, cardiac surgeon, and he is having experience of more than 3 decades in the cardiac surgery, and he has conducted more than 8,000 cardiac operations within India and overseas at the University Hospital Uppsala, which is in Sweden. Dr. Kohli was also instrumental in setting up cardiac surgery departments and initiating cardiac surgery in various top-notch hospitals within India, such as Escorts Heart Institute, Batra Hospital, Hero DMG Heart Institute, Sri Balaji Action, New Delhi, and Arjuna Heart Institute, which is in Nagpur. Dr. Kohli is an avid believer in the practice of holistic medicine and passionate about integrating Ayurveda, naturopathy, and other complementary systems into the mainstream of medicine. Dr. Kohli has also received multiple honors, including Distinguished Person Award from the Old Martinians Association in 1999, having excelled in the field of cardiac surgery. Certificate of Merit from Apollo Hospital, Chennai in 1985 for contribution towards successful completion of first 1,000 open heart surgeries, and Certificate of Appreciation from the Old Martinians Aus- Association of Australia in the year 1999. And today, Dr. Kohli and we have chosen a very, very interesting topic. I think a very important topic, a very pertinent topic in the times that we live by. Root cause of gut issues and their holistic management. This is a very, very important and interesting topic because, as we understand in the medical field, that gut is the genesis of good health, and also a kind of root cause for the entire problems that manifest in various forms in the body. So, with this, Dr. Kohli, may I request you to please go ahead and start your webinar? Over to you, Dr. Kohli.
Thank you very much, Anuj and Devesh for giving me this opportunity once more. It is again a great pleasure to be here with you, and this time, of course, to discuss on this very important subject. Now, there's a lot to discuss about. I'll try to make it as brief as possible, but I know that no matter how much we talk about it, we probably can never give full justice to this particular system in the body. Now, we have already always known that every disease begins in the gut. This has been a premise for many, many thousands of years now. Ayurveda talked about it, Hippocrates talked about it. Now, then the gentleman, Dr. Ludwig, in 1848, he said, "We are what we eat." Unfortunately, this is no longer true because now what we are eating is far different than what we were eating in the 1800s and 1900s even. So this has now been modified by a gentleman, Dr. Josh Axe, who says that we are what we can digest, not what we can eat. And he further goes on to say that leaky gut is at the root of most diseases, which we are going to discuss in fair detail today. So, moving further, now most of us feel, even doctors, that the gut is important only for digestion, absorption, elimination, etc. But this is very, very simplistic indeed because the gut plays so many important roles in the body. As you can see from this slide, the gut has a role to play in immunity, skin health, mental health, digestion, sleep. And there are many more functions as well. And we will take this up in fair detail before going further into our discussions. Now, when we talk of digestion, we learn from Ayurveda that digestion means digestion, absorption, assimilation, and excretion of whatever we eat, whatever we drink, whatever we see, whatever we hear or think. Each, every single one of these, whatever comes to our mind or happens in the body has got to be properly digested, absorbed, assimilated, and the waste has to be thrown out. If that does not happen, it accumulates as what is known as arm in Ayurveda, and which we now call as inflammation. So the gut is important from the point of view of many factors, as I mentioned already. One of them is that the gut has a very important role to play, or rather, is controlled by the gut microbes. We have a microbiome in the body, which have many functions. We are going to discuss this in detail. 70 to 80% of the body's immune system is concentrated in the gut. There are many more factors. The gut also produces certain hormones like melatonin, etc. We'll discuss this further. Unfortunately, what has happened is, though we are dependent on the gut microbiome for our very survival and for the function of every single part of the body, despite that, unfortunately, what has happened is that modern humans now have lost most of our friends in the form of these gut bacteria. To give you an example, oxalobacter is very rare to find in our bodies now in the gut, which is one of the factors why calcium oxalate kidney stones have come to the fore. Similarly, Bifidobacterium infantis. This was important for giving good health to our babies. These are also virtually deficient in the gut microbiome at this point of time. L. reuteri has been important for oxytocin release and therefore important for empathy and connectedness. That also is now gradually evaporating. Bacillus fragilis, which supports the immune system, is also now deficient. So there are only a handful of species in the world, like the Hadza, the Marsis, and the Yanomami, who have who have the microbiome of the hunter-gatherers, but that is deficient in more than 90% of the world's population, and which is one of the reasons why we are suffering so much. Now, there are many axes in the body. There's a gut heart axis. There's a direct correlation of gut function to the function of the heart. We know that 70% of the body's inflammatory cells are actually housed in a tissue called the gut associated lymphoid tissue, which is found in the gut. Abnormal chemicals are produced because of abnormal bacteria, which are harmful to us. We'll discuss this in a little more detail later. So, the gut impacts almost every system of the body, be it the brain, hormones, the immune system, liver, oral health, skin, or heart. So every system is impacted. Now, Dr. Tom Urban has gone so far as to say that the gut has its hands on the steering wheel of our brain, which is one of the reasons why the gut is also known as the second brain. And this is quite true. Now, how does the gut affect the brain? We'll discuss this in a little detail. This it does through the autonomic nervous system, mediated through the vagus nerve, also through the immune system, microbial metabolites like 5-HT and serotonin, environmental influences like antibiotics, diet, pathogens, stress, chemicals. Now, this is so because the gut is actually an extension of the skin, hence comes in contact with the environment directly. So, the gut is exposed to the environment directly before anything else happens in the body. Now, what is leaky brain? Now, we know all about leaky gut, but leaky brain is also a very important entity. This is basically stands for blood-brain barrier dysfunction and is associated with increased permeability and breakdown of tight junctions. And this, of course, has many problems which take place, which we'll discuss later. So, as far as leaky brain is concerned, first thing which happens is release of zonulin. Zonulin we will discuss later, but zonulin basically is that protein which is responsible for the functioning of the tight junctions in the intestines. We have a similar barrier in the brain as well. There also zonulin comes into being. So when zonulin is released, immune responses take place, the brain becomes leaky, leading to neuroinflammation. Then, as we move further, neuroinflammation manifests as mood disorders, anxiety, Alzheimer's disease, autism, dementia, schizophrenia, mental fatigue, brain fog. Now, all of these things have become very common these days. So don't be surprised that all this is being dictated by the gut. This may come as a bit of a surprise, but it is important to understand. So there's a brain gut connection. So I told you about the heart and brain connection. There's also brain gut connection. And this is mediated through stress, the relaxation response, emotions, our feelings, mood. The gut and the brain influence each other. Positive feelings are healing, negative feelings are harmful to us. This is all mediated through the vagus nerve, as I mentioned to you, as you can see in the picture. The vagus nerve is the longest nerve in the body. This starts from the middle of longata and goes down right till the rectum. Therefore, it supplies twigs to every single part of the systems in between these areas. So, the lungs, the neck, the face, the liver, the gut, the kidneys, the colon, all of these are affected because of that. And this has a to and fro flow. That means if there's anything wrong in the gut, it goes to the brain. If there's anything wrong in the brain, that manifests in the gut as well. So this vagus nerve has assumed very great importance. So since it is connected to the brain, I've already discussed this, it affects practically the entire, almost all the systems in the body. Now, there's something known as gut feeling. We keep reading about it, keep hearing about it, but from the scientific perspective, we've not attached much importance to it. But if you look at it from the spiritual perspective, even from the yogic perspective, it has a very, very great importance to play. So, your gut feelings are a combination of gut bacteria communicating directly to your brain via chemical messengers, etc. And these, of course, gut feelings can be of many types, basically three types. Implicit knowledge, they can give us an implicit knowledge, and your gut feeling is almost always correct. Then it can give you energetic sensitivity. This includes those moments when you feel like someone is staring at you. You're not seeing the person. When you turn around, you find that the person has actually been staring at you. Then it also is related to non local intuition. Now, the gut, as I mentioned, has a very great role to play in immunity. About 85% of all immunity is located in the gut wall. And I've quoted Dr. Natasha Campbell McBride in a very famous book called Put Your Heart in Your Mouth. So, gut flora is the right hand of the immune system, also. As I mentioned to you, the gut dictates the functioning of the brain, so also it dictates the functioning of the immune system, as I've already mentioned that before. Now, I will not go into details of the gut and the immunity part of it, but suffice to say that both aspects of the immune system, whether it is uh, the dendritic cells or which related to the innate system, or to the other system of immunity, dendritic cells are also found in the intestinal walls. The adaptive immune system comprising of T and B cells are also related to the gut. Now, after these are produced, T and B cells are produced in the bone marrow and the thymus. And when the T cell leave the thymus, they come into the gut through the circulation, and B cells migrate to the Peyer's patches in the gut. So the gut has both the systems of the immune system, the innate and the adaptive immune system. Both are important, as you know. Now, in this, there's something known as the T regulator cells, which are important because they turn on the alarm or turn off the alarm as the problem has, if the problem has been resolved, they turn off the thing. But if they're not functioning well, then of course you can have problems of autoimmunity, which again are mediated through the gut. Now, something we rarely talk about is mucus. We've taken mucus to be a sort of a nuisance, but actually it is not. This is a glycoprotein produced on the columnar epithelial cells, acts as a physical barrier. It helps stomach to contain the hydrochloric acid, prevents the stomach from getting damaged because of the hydrochloric acid, and therefore it prevents direct contact with GI microbes with the intestinal lining. These are the roles it plays. Now, the colon, you'll be surprised to know, has a double layer of protective mucus, while the small intestine has only one layer, which is one of the factors responsible for conditions like small intestinal bacterial overgrowth and small intestinal fungal overgrowth, which are very common these days. Now, there's certain things which increase the activity and the functioning of the mucus, and these are very common household things which we use, like garlic, onions, bananas, oleic acid in oil present in olive oil, cloves and cinnamon, and green tea. These are important, which is the reason why we prescribe them so often. But there are many things which disrupt the mucus. I mention this right now because later on it may become a bit of a mouthful. Now, when we use food emulsifiers added to processed foods, they disrupt the function of the mucus. Maltodextrin does it. Chlorinated drinking water, chlorine in swimming pools, that gets absorbed through the skin. Emotional stress, all of these are bad for the mucus. Non-steroidal anti-inflammatory agents like brufen, indomethacin, naproxen, diclofenac, all of these are very bad for the mucus. If whenever these are given long term, you are bound to have gut issues. Antibiotics, food additives in soft drinks, juices, canned frozen foods, styrofoam containers. These have become so common. People take the small plastic cups, not realizing that the styrofoam present there is actually damaging your gut. Plastic trays, microwaves, ice cream, and things like that. There's so many factors which disrupt the mucus. So the entire GI tract is full of microbes, and different parts have different microbes. As you can see, the stomach has lactobacilli mainly, streptococci. The jejunum and ileum have lactobacilli and different types. The colon has a huge variety of these, bulk of them lying in the colon. So different parts have different microbes. Now, why is they are important? Now, we humans have about 20,000 genes. The gut microbes constitute 100,000 genes. Even a snail has much more genes than we have, just to give you an example. And our health, therefore, directly proportional to the genes present in the gut. We carry about 1.5 to 2.5 kg of bacteria in our body, and there's a symbiotic relationship between these, and they serve very important function as will become obvious. So these can be basically three types: the good or the probiotic, which are essential, which each one of us must have. Then second are the opportunistic flora, which come into the floor when the essential ones get damaged because of some reason. And there's a third type known as the transition, which are gained from the environment. Now, I've purposely mentioned this thing. Studies have been done in India as well, where they have found out the type of bacteria or the microbes present in the gut in different parts of India. Now, what do they do? They act as I mentioned, physical barriers. They produce antibiotics, antifungal, antiviral substances, all of which are non-chemical and therefore very helpful to the body. They chelate heavy metals like mercury, lead, aluminum, and even carcinogens. They convert food into healthy substances. In short, they keep us healthy. Now, if they are not present in adequate amounts, then normal digestion is not possible without them. They also produce certain enzymes. They produce vitamins K2, B1, B2, B6, B12, folate. Now, deficiency of these therefore leads to B12 deficiency, which is very common. And generally, as I've noticed, if you find a person having low B12, you just start pumping in B12 without realizing that the cause could very well be because of inadequate microbes in the gut. And as I mentioned earlier, they affect the immune system also. Now, the important thing to know is where do they come from? They come from the mother at the time of birth. As the baby goes through the birth canal, the baby picks up these healthy microbes from the vaginal tract of the mother. Therefore, it is important that the mother also be housing good bacteria, should not be drinking, should not have had any drugs which could be damaging their gut microbes. And therefore, the mother is very responsible, and especially during pregnancy, she should be very careful about what she eats, what she thinks, and what she does. They also come from the mother's and father's bodily flora, and the skin and mucous membranes also get coated by these bacteria. So remember, breast milk also plays an important role for this. Now remember that the small intestine plays an extremely important role as far as gut health is concerned, because the small intestine has microvilli, which all of you are aware, and it's important. So I was talking about zonulin. Now zonulin is that protein which is important for the functioning of the tight junction. As you can see, these cells, these are all tight, so nothing can percolate through them. But if there's a gap in between, then large molecules can directly enter the bloodstream. As you can see here, a leaky gut is what happens. A leaky gut means this. This is just a sort of a symbolic presentation that if the can is full of holes, then what is going to happen? It cannot retain any water, and therefore it all leaks out. So here, if you see, These junctions are tight, that means the zonuline is okay, but here they have become loose. And because of that loss, what is happening, large molecules are entering directly the bloodstream, into the bloodstream without getting metabolized, without getting digested, and therefore all abnormal chemicals are also entering them. And these are the factors which are responsible, which are the triggers which are responsible for leaky gut to take place. I'll go into this a little more detail later. So, in short, if you have a leaky gut, you can have sinus infections. Now, as I noticed, almost every ENT surgeon is treating sinusitis differently. But it is my request that if you see sinusitis, please think of leaky gut being the cause for that. So that must be addressed before you can actually correct sinusitis. Similarly, mouth problems, joint problems, thyroid problems, Hashimoto's disease, skin problems, etc. All of these occur because of leaky gut. Now, what causes leaky gut? Types of food like gluten, alcohol, dairy, eggs, GMOs, grains, legumes, chemotherapy, radiation, parasites, small intestinal bacterial overgrowth, yeast overgrowth, lead, mercury, cadmium, pesticides, acid blocking drug like and antibiotic, birth control pills, NSAIDs, prednisone, antidepressants, olmesartan can lead to exactly the same symptoms as celiac disease. Please remember this. And of course, stress. There are many more factors. I've only given a sort of a nutshell of that. So, what happens when these get disordered? I've already mentioned that it leads to systemic inflammation and, of course, poor health, leading to heart disease as well. Now, the sequence is initially you have a healthy gut, which is what we all want, but if it starts leaking, it leads to dysbiosis, which further leads to SIBO and or C4. SIBO means small intestinal bacterial overgrowth, and C4 means small intestinal fungal overgrowth. These are all very common. So coming to dysbiosis, when the amount of healthy bacteria in the gut are too low, then we term it as dysbiosis. At times, there may be an overgrowth of yeast, parasites, etc., etc. But mostly, as long as the dysbiosis is present and they are localized to the gut itself, then it is just pure and simple dysbiosis. But it can migrate to different other parts of the intestine as well. And there's been some studies to show that dysbiosis has been playing a role in rheumatoid arthritis and also MS, that is multiple sclerosis. This may come as a bit of a surprise. Now, dysbiosis are many types. The commonest type is insufficient good bacteria, which is the mildest form. SIBO occurs in the upper part of the small intestine. That is, when these bacteria migrate to the small intestine, they may just be present there, may not be causing too much of a problem. This is not that bad. But then the third type is immunosuppressive dysbiosis, when the harmful bacteria, yeast, or parasite lower the levels of good bacteria and give out toxins in the gut. Then inflammatory dysbiosis, when the body has an exaggerated response to the bacterial imbalance. And finally, parasites may also infect the digestive tract. So the various grades of dysbiosis. Now, when there's SIBO, as I mentioned, SIBO is small intestinal bacterial overgrowth. This is a manifestation in two parts of the body, in the gut itself and outside the gut. In the gut, you have problems like IBS, that is irritable bowel syndrome, diverticulitis, constipation, diarrhea, alternating constipation and diarrhea, cramps cramps and pain, bloating, excessive and odorous gas, nausea, acid reflux, heartburn, excessive burping, leaky gut, and nutrient malabsorption. Obviously, if the food is not getting absorbed, you have problem with malabsorption syndrome as well. While outside the gut, it can lead to hypothyroidism, aches and pains, fibromyalgia, weight problems, autoimmunity, food sensitivity, skin issues, tiredness and fatigue, brain fog, brain injuries, anxiousness, depression, nutrient deficiency, diabetes, gallstones, fatty liver. So practically everything can occur because of this. So these are the various presentations. Now, these are telltale signs of SIBO. I've already mentioned them, but there are some more like restless leg syndrome, constipation, type 2 diabetes, pre-diabetes, fibromyalgia, irritable bowel syndrome. Now, whenever you see such a patient, then I think it is important to take a very detailed history. So all of these points should be assessed as far as the patient is concerned. History of chronic diarrhea, history of cramps, urgency, mucus in the blood or stools, chronic constipation, or alternating constipation and diarrhea. Sorry, I've gone further. Decreased cognitive function, brain fog, intolerance to carbs, beans, fibers, especially food sensitivity. So It is very well in order to test for food sensitivities, deficiency of vitamin D. If you've ever had a deficiency of vitamin D, which is rampant these days, again, think of the gut. Arthritis, fibromyalgia, fatigue, or low energy on most days. This is also very common. Patients complain of being tired and fatigued, and we really can't figure out what the reason is. Think of this: chronic sinus congestion, vaginal or anal itching, chronic bad breath, history of antacids, more than 30 days in 2 years, history of antibiotics, more than 3 times in 1 year, autoimmune diseases, history of reflux, heartburn, hiatus hernia, etc. So if you do a scoring of these, if the score is between 0 to 7, it indicates either no or very mild dysbiosis. If the score is 8 to 14, such as mild to moderate dysbiosis, this needs fixing. 15 to 20 means indicates severe dysbiosis. So this is a very important guideline. Now there are many conditions associated with SIBO, and this has been worked out not in India but in the US. And the statistics show that obesity is very common because of is an associative factor in SIBO, diabetes, IBS, inflammatory bowel disease, fatty liver, Parkinson's disease, autoimmune diseases, skin rashes, Alzheimer's, restless leg syndrome, and depression and anxiety. All of these are very important factors. Restless leg syndrome is almost 100% associated with SIBO. Now, conditions associated with leaky gut are almost the same because leaky gut and this type of SIBO is almost synonymous because they have a very similar presentation. Now, some factors which are overlooked, which you don't even think of. So, the common factors which we don't think of are molds. Now, this is something we have not been talking about, not been thinking about, but molds in old buildings where there's leakage of water, there's dampness, you find a lot of fungi growing in the homes, and they lead to decreasing the levels of short chain fatty acids, which are conducive to good health, and increase harmful bacteria and decrease the beneficial ones. That is one. Second, electronics. The latest vampire is what it has been labeled as electromagnetic waves, Wi Fi, TV, smartphones, computer tablets, microwave ovens, Bluetooth devices, X rays, CT scans, MRIs. Please, it is my request, don't take CTs that lightly. X rays are not as bad, but CT scans are. You're exposed to a lot of radiation because of that, no matter what people might say. They lead to what is known as electro pollution in the body. Then disinfectants. We've been using disinfectants right, left, and center since the advent of COVID. Be very careful, please, or try to use disinfectants which are organic or non chemical. Heavy metals. This is something we don't even think of. The commonest are lead, arsenic, aluminum, cadmium, and mercury. These are very lethal for the gut microbiome. Many people have high levels of toxins in the body without even knowing about it, and a high concentration of these may lead to hypertension and other issues also. So, for practical purposes, dysbiosis, SIBO, C4, and leaky gut go hand in hand. C4 you generally suspect if you find that there are fungal infections elsewhere in the body also. So, if there's a fungal infection somewhere in the skin, it is quite likely that the gut also has a problem there. Now, how do we manage this? We do this by following the principle of 4 R's. Healing the gut means first remove. Now, you may recollect that removal has been the cornerstone of treatment in Ayurveda. That means detoxification is the most important thing. You first have to remove what is abusing the system, then restore healthy bacteria, re-inoculate healthy things into the gut, and then, of course, repair the gut. So, this is a principle which we follow, and this is a very important slide because, in a nutshell, it tells you exactly what you need to do to manage SIBO, leaky gut, and all that. So, remove anything that disrupts the environment or the GI tract, which you do by removal of all toxins by various detoxification methods. There are many methods. We are going to discuss them, briefly later on. Elimination of all harmful foods. Uh, I'll mention these. Mucinex is a very important thing which has been used very frequently during the COVID days. So this is important, and you can try that. Milk thistle also plays an important role. Improving bowel function by giving magnesium glycinate, psyllium husk with chia seeds, flax seeds, prunes, rhubarb, and trifla. Trifla plays a very good role out here. Removal of pathogens like you do this by giving rifagut, Rifagut is an antibiotic which is not absorbed in the gut. It is supposed to be quite effective, though, as I understand, it is effective in just about 40% of cases. We give Econom, which is healthy gut bacteria. Candicist is an antifungal, and garlic. Now, of course, it would be a good idea if you can actually prove that there is fungal infection, which you may be able to prove, may not be able to prove. But if they are very severe infections, I feel you could assume that fungal infection is also present. In that case, you can give all these together, Rifagut, Econom, Candicist, these two for 2 weeks, this for 3 weeks. So 3 weeks is generally enough for eradicating the fungi. Garlic plays a very important role in this also. Now, after this, you have done this, you restore. After the bad has been removed, bring back the good. So you give digestive enzymes. Omega 3 plays a very important role. Omega 3, the ideal way to give it is giving cod liver oil if it is possible, but cod liver oil, vegetarians may not want to have it. And another issue is that most fish contain mercury. So we are in a bit of a bind out here. But there are certain good brands available which can be used. Reinoculate with healthy bacteria. So you give probiotic, like the better ones are VSL3 and Velgut. Now these have a different combination of bacteria compared to Econom. So initially you give to Econom, then you change it. I feel what we should do is that over a period of time we should keep changing these probiotics, because just to get a universal presence of different types of bacteria. Probiotic foods, fermented foods like yogurt, like chach, raita made of hung curd, kanji is what is made in our homes in winters, fermented vegetables, homemade pickle, kimchi, sauerkraut, kefir, etc. Garlic, onions, green bananas, leeks, asparagus, flax seeds, cocoa beans. They are good for the gut. Coenzyme Q10, vitamin D, and berberine. Berberine has become a very important factor for healing the gut. And finally, repair the gut lining by giving injection of vitamin C in high doses, glutamine, quercetin. If quercetin is not available, you can give garlic, cold press extra virgin olive oil, coconut oil, juice of cabbage, celery, and beets. Now, in a nutshell, this tells you what you can do for the gut. Now, you have to avoid all chemicals, cosmetics, perfumes, deodorants, use natural fragrances if you want to. Stay away from polluted areas, plastic in any form, chemical toothpaste, use non chemical toothpaste, soaps, shampoos. All of these contain chemicals and are very harmful to the gut. Heavy metals, aluminum foils, avoid using aluminum foils, utensils made of aluminum. Mercury fillings is another big problem which we cannot discuss in detail right now. We'll probably need another hour for that. Paints, pesticides, hand rubs, room fresheners, antibiotics, PPIs. PPIs should never be given over a long term, nor do antibiotics also. Inflammatory foods, don't give avoid refined foods, preserved, packaged, out of season gluten, milk, and dairy food. Stress, anxiety, etc., has got to be avoided. Now, wheat is a very, very important no for all of us, whether you have a problem or you don't have a problem. It will ultimately lead to leaky gut, SIBO, etc. Take it from me, it is going to lead to complications. So please avoid it. Milk, type of milk which we are getting does not contain the right type of casein, therefore it is very harmful. Try to avoid that. If at all you are very fond of milk, you can take A2 casein milk, which you can get on, I believe, Amazon, or goat or sheep milk, which is not very easily procurable. Antibiotics, I just make this statement. Antibiotics are like a hydrogen bomb set off in the GI tract that leaves a path of microbial devastation. I'm quoting Dr. William Davis from his very, very famous book. Now, intermittent fasting plays a very important role. Intermittent fasting is helpful in practically any chronic disease. I will not go into details, but just remember that it is very helpful. I mentioned about removal of toxins. I'll rapidly run through this. Now, you can do that through detoxification. I'll mention a little later. You must stimulate the vagus nerve. I've already talked about the vagus nerve earlier. This has an important role to play. So, for as far as detoxification is concerned, the body has inbuilt mechanism of sweat through the skin, stools through the rectum, urine through the kidneys, and carbon dioxide through the lungs. So these are the four systems which we have, all males have. While ladies also have the fifth one, that is menstruation. So when they are menstruating, they are also detoxifying themselves to a certain extent. And of course, tears and wax in the ear, they also play some secondary roles. So any of these don't function well, then toxin accumulate in the body, and that is happening to us. So detox through the skin by dry brushing. You can, if you want to detox the body, then you have to resort to certain therapies. For the mind, resort to breath. For the spirit, resort to meditation. So all of these play important roles. Now, the most important thing as far as detoxifying the skin is concerned is far infrared therapy. This is available in most of the bigger cities. This is extremely effective, and it must be tried if you can do that. Enemas of various types are very helpful as far as detoxification is concerned. Neti, the age-old neti, I prefer the jal neti rather than the sutra neti, because sutra neti is likely to damage the nasal mucosa. So this is fairly safe and quite effective. Use of mud packs, which naturopaths use. Now, high dose vitamin C, something I'm going to mention a little briefly about. Now, this can be given as an IV push, a slow infusion, rapid infusion, or even a continuous infusion depending on the situation. The usual dose is 1 to 1.5 grams per kg body weight. You generally start low, 5 grams initially, maybe first two drips of 5 grams, second or 12.5 grams, and next 25 grams onwards. Now, we do not have a fixed dose of vitamin C for anybody. The dose has got to be understood. What happens is that when you start the IV vitamin C infusion, then you check the blood sugar at the start of the infusion and then at the end of the infusion. Now, the point at which, or the depending on how much of vitamin C you're given, the point at which the difference between the two sugar levels is more than 350, that indicates the correct dose of that particular person. So you got to gradually reach that dose and maintain that dose. And this has multiple benefits. It would be better if you could do a webinar on vitamin C alone, because there's a lot to talk about. And then there are certain natural laws which determine gut function. We know that there are three basic principles of nature, like movement, transformation, and structure. So if the movement is correct, that the flow of prana is good, then after every proper movement, some transformation is bound to take place. And this then leads to the formation of structure, of the correct type of structure. Now, gut function depends on natural laws, as you're all aware. So, movement is responsible for chewing the food in the mouth, movement of food bolus from the esophagus into the stomach, then peristalsis for further movement of the for the waste products. And this is largely dependent on the vagal tone of the parasympathetic system. Therefore, keeping that in balance is very important. So, movement also plays another important role. Now, this is looks a little funny, all right, but movement stimulates the primitive response of survival with subsequent healing responses. So please ruminate over this. Now, why do we sleep? Again, sleep, as I mentioned, is an important thing, because one of the principles of nature I mentioned about movement, transformation, and structure. And sleep is essential for transformation. It is a very, very important detoxifying function which is carried out through sleep. Now, transformation brings forth the healing, the coming to integrity, to wholeness. Now, this is spiritual, but it is important. So, as you can see, with proper movement, transformation takes place. As you can see, the formation of the butterfly, there's been a movement from one state to the next, to the third stage, and finally to the butterfly stage. So, movement is that important. Exercise, we all know, is important, especially high intensity interval training. Non-competitive swimming, I am stressing on the word non-competitive, because when you compete, your ego comes into being, and the ego, is more harmful than good. Stationary cycling, all of these are good for you. Sleep, I already mentioned that sleep is not rest alone. Nothing rests while we are sleeping. A lot of things are happening inside. So, a good restful sleep is very important. Then, of course, relaxation. And for this, there are many things you can do. You can resort to Qigong, Tai Chi. You can resort to any of these, as I've already mentioned before. You can do face yoga. Perhaps we should discuss it in detail some other time. One of the methods is Kapol Vikasa Kriya. Then yoga, of course, is very important as it does so many things. Now, what I want to stress about yoga is it brings awareness, which helps us to eat and do things which benefit us. So, awareness is what gets awakened, and when that happens, it tells us what we should do, what we should not do. Apart from the so many other benefits of yoga, we know the other benefits. So when you do pranayam, the slow deep breath leads to relaxed nervous system, calms your mind, and induces connection with the supreme being, compassion, intuition, creativity, and healing, all of which are important for us. Yog Nidra is perhaps the best method of relaxation, and I feel that everybody should do it every day. Om chanting is supposed to be very good. Meditation, of course, is the best method, and I will like to quote Sri Ravi Shankar. Meditation is the journey from sound to silence, from movement to stillness, from a limited identity to unlimited space. Chakra meditation, meditation, as you know, is of many types. One of them is the chakra meditation. So if you can meditate on any of these chakras, and as you know, the chakra, depending on where they are located, they stimulate that part of the body. They stimulate the subtle system of the body in those areas. So chakra meditation is also quite helpful. So if you meditate on the chakras, they are going to be helpful. Then of course meditation has many other advantages as well. I'll read this out. It takes us to the present moment during which all chakras are balanced with perfect flow of energy in the body. The heart pumps at a slow rate, delivering life giving blood to the rest of the body. Oxygen percolates into the alveoli of the lungs, goes to the gut microbiome, promotes them positively. It improves digestion, has a good effect on the parasympathetic system, and ultimately the perfect state of grounding. So meditation has a lot of things to do. So therefore, to conclude, please remember these important points. The gut is like a fertile soil. Therefore, nurture it. Give it natural food and natural environment, not the trash which we are eating. I'm sorry, I just need to go back to this. We are what we can digest. Please remember this. So, whatever we eat, drink, hear, see, and think do are all important. Please remember that. Management comprised of the 4 hours, I've already mentioned that. Move, relax, and meditate. Thank you very much.
Many thanks, Dr. Kohli, for the wonderful session.
Thank you.
I must say that it was so exhaustive and so kind of detailed, that I am very sure the young doctors, the budding doctors of Ayurveda, as well as allopathy, and even common people like me, will certainly be more enlightened and kind of understand uh, how gut is very very important in the overall management of the health, right? And as you rightly
Obviously,
mentioned, Dr.
you're not common. You're
So I know little of medical science because of doctors like you, sir. So I mean, Dr. Saab, it was very very nice. Just few point and my request to all the doctors who are listening to us, please, you can post your questions on YouTube, Insta, Facebook, and the page of indianvedas.com on which it's live. We'll have Dr. Kohli to answer that. Dr. Kohli, you mentioned very rightly that I think that was one of the best quote, that it is not what you eat but what you digest, right? So earlier the notion was that it is what you eat, but now the with the passage of time the notion has changed, that what you digest, that's more pertinent and more important. In that context, Doctor, you mentioned that wheat, because North Indians typically, if you look at, without wheat, if you tell somebody to live, it's very very difficult, right? So in that context, how do we see, substituting wheat with uh, the kind of diet that we can have to have a healthy gut? Yeah, Doctor.
See, the thing is that, as I mentioned, wheat, the type of wheat which we are getting now, is far worse than what we used to get, some say, about 100 years back. That is one. Even then, it was not ideal, mind you. Now it is even worse than that because now we are getting hybrid wheat. And this started in the year 1960 when PL something, there was a number attached to it, was pumped into our country and China also, because
Correct.
of which our problem started then. Now, wheat, as I mentioned, is an important agglutinogen. It can lead to celiac disease as well as a non celiac disease as well, where you have wheat sensitivity. It is very common. Now, I believe that if you take wheat, sooner or later you're bound to have complication, because this is bound to lead to leaky gut ultimately. Now, I'm stressing on that. So, what I feel is, and my understanding is, that during the hunter gatherer days, wheat was not commonly grown. That is 12 to 15, 12,000 years back, wheat was not a staple diet of people. The hunter gatherers were not eating wheat that much. They were eating whatever they got from the soil, and that could be anything. Whatever they got was natural. Now, wheat, apart from containing gluten, it has many other disadvantages, like it has wheat germ agglutinin, and I'll not go into those details, but I just want to mention that alternatives to wheat are many. And all the millets which we have such good millets growing in our country. All of these are good for you. Now, again, if you are diabetic,
Mm-hmm.
then even those will have to be stopped initially. But if you're non-diabetic, you want to lead a healthy life, you can resort to eating millets. And the common ones are bajra is very common, which now in winters you're going to get. You can eat ragi, you can eat jwar, amaranth, singhade ka atta, and also kale chane ka atta, besan, coconut flour. All of these are very good for you. And the other factor is that when you eat millets, then they are slow to digest. So you don't feel very hungry very much. So it is easier to fast also if you are taking a millet type of a diet. And millets, if you happen to be a good cook, I'm not. There are many permutation combination of millets which you can eat. They're very, you can eat khichdi, you can eat, there's so many things which you can make out of that. So I will again insist that try to avoid eating wheat. I know that our traditional diet has been wheat, but over the years, this leaky gut and these things never occurred before. Let me also
Mm-hmm.
tell you now, dental infections or dental decay started from the time wheat started being eaten. Prior to that, the hunter gatherers never had dental issues. Once wheat started, we started having those issues because wheat contains sugar and, of course, gluten. And you see there's a rise of autoimmune complication these days. Every other day you find, I'm sure every single doctor in our country would be seeing a lot of autoimmune condition now. And the mainstay of treatment there is stoppage of all grains because they all contain gluten. But wheat is the biggest culprit. So I know it comes as a bit of a bombshell, but please take it from me that wheat is very harmful to you. And once you stop eating wheat, your weight starts coming down immediately. And wheat is very addictive, therefore not very easy to leave. It produces opiates just like sugar. So when you eat wheat, then it is addicting for you. It is very difficult. So you have to find a better source. When you start relishing eating millets, then you forget about wheat. So now I've been off wheat for about 3 years. Of course, in exceptional circumstances when other food is not available, I have to take it. But almost uh, just about say 10%, 90% I'm off wheat completely. So it is possible to do it. And I stopped it just to see what happens. If I can do it, I can recommend it to my patients also, which is what I'm doing.
So I think I should also give it a try, Doctor, from today itself.
You'll be
Yeah.
very happy with it.
Yeah. So, Doctor, another thing that you mentioned was the antibiotics, right? Because there's a lot of data, I think, on the table to show that how the use of or the rampant use of antibiotics today, if you look at, right, uh,
Okay.
uh, leads to very, very complicated issues in the gut and then kind of destroying the good bacteria, right? But then, Doctor, we also have that, kind of catch-22 situation in which a patient comes and then, right, without strong antibiotics in times of today that we live, right, especially in India, right. Without, I think, antibiotics, it's very difficult to have a healthy life today. So, in that context, how do you see balancing the, both the perspective of a patient as well as kind of taking care of the gut? So, how do one find such a balance in that?
There are two things to this. One is, of course, if you can prevent all that, that is the ideal thing to do. But I do understand that we are going to be faced with a situation where antibiotics would have to be given.
Correct.
Now, if you have to give an antibiotic, one, give it for the minimum period, which is important. One. Number two, definitely give a good probiotic along with that. It is very important. So would be a good idea to start giving econom. I'm not promoting econom, but that's what I've been using frequently, and I've been quite happy with it. And also, even when the antibiotic has been stopped, continue to give a probiotic for a longer period of time, at least for 3 weeks. So this is one aspect of it. The second is, which is difficult for people to accept, though it is extremely good. We have an extremely good natural antibiotic in the form of vitamin C. Now, I'm sure you would have read some studies on that, that during the COVID period also, in Wuhan
Definitely.
itself, they gave IV vitamin C to patients, and many of the patients recovered. So vitamin C has a lot to do with it, but unfortunately, because it is a very cheap molecule,
Yeah.
certain vested interests are not letting it get promoted. In fact, doctors who are promoting it are being penalized in certain parts of the country, in certain parts of the world. Even their license has been taken away from them because they've been promoting a natural antibiotic like vitamin C. Vitamin C is extremely effective. I can vouch for that. I've started using it wherever it is possible to do. But please remember that you can read up about vitamin C. You may get a biased response if you go to the internet and all that, but there are lots of good publications on that which I can share with you if you want. So keep this in
Sure.
mind. Wherever possible, if you give high dose vitamin C, which can be given in many ways, which is cannot be discussed right now because there's a lot and lot to it. It will require an hour to discuss vitamin C alone.
Just doctor, building on to that, the context of vitamin C that you've brought in, right? Vitamin C, we know that amla, being one of the most natural and the potent source of vitamin C, and in Ayurveda, amla is called as the mother of rasayanas, right, because of its various effects, right? So, how does amla in various forms, right? We have chawanprash, we have amla churna, right, and there are various formulations in which we use amla, right? So can that be also a good source of maintaining a healthy gut?
This is an excellent question, and I'm very happy that you brought it out. It is important from the point of view of course, health. It is important, but what I want to stress on is that from diet or from amla or lime or whatever the sources, natural sources are, that will give you just enough vitamin C to prevent scurvy, but
Hmm.
it will not be enough to be able to fight these infections. For that, you need a very high level of vitamin C. And as I mentioned in the presentations, that vitamin C does not have a fixed dose for anybody. And
Correct.
vitamin C, when it is given orally, most of it gets just excreted out. So there's a protocol for that. The best
Hmm.
form of vitamin C orally is ascorbate, which is the best is to give as a powder form. And the protocol which is followed is that on an empty, you must always give vitamin C on an empty stomach. Do not give it after a meal because it stimulates peristalsis. So you may start getting cramps and things like that. So give it on an empty stomach. Start in the morning. Take about 5 to 10, say, take about 1 to 2 teaspoonfuls of ascorbate with water. After an hour or so, take some more. Keep on taking like that till watery diarrhea occurs. Now, when watery diarrhea occurs, it means that you have reached the right dose. So then what happens is you take the dose just prior to the point where the watery diarrhea occurred. This is the way to calculate the dose of vitamin C. So some people tolerate not more than 2 grams in 24 hours. Others tolerate 10 grams, yet others tolerate 20 grams. So there's a big variation. Now, there's another form of vitamin C which is available, which is called liposomal vitamin C. The liposomal vitamin C does not have any gastric problem, so you can go to a higher dose. The only thing it cannot be given for a very, very long term because it has soya and all that in it. Therefore, so vitamin C has many forms. So it can be given IV, can be given orally as liposomal or multi-C protocol where you can give both IV as well as oral. So vitamin C, as I mentioned, is a very important thing, but it has to be understood how to give it. It is not like give one tablet thrice a day. It doesn't work that way. So you have to give the right dose at the right time and the right amount for the right problem. That is how it works.
And Dr. Saab, how do we look into the context of uh, vitamin C derived from natural sources, say like amla, lemon, orange, right? And then from the synthetic sources like the tablets, we have Limc and others and all, right? So because there's a lot of debate, that or maybe myth in the mind of the consumers that a synthetic one is much better and potent rather than the natural ones directly taking amla or say like oranges or lemon. So how do we one should kind of look at it, sir?
You have to look at it from the point of view of the fact that the soil where all these things are grown are not enough. The soil is deficient in a lot of nutrients. So because of that, what is happening is that, say about 10 years back, the quantity of vitamin C you might be getting in the foods which are being grown would have been much higher. Now they are much lesser. That is one aspect to be considered. Number two, as I mentioned to you, whenever you take these oral sauces, they will prevent scurvy. But no matter how much you take orally like this, they are not going to be adequate for preventing or treating a problem. Now, coming to the tablet form of it, now what you get with most chemists are the synthetic ones. So, synthetic vitamin C, I quite understand, cannot be as effective. Plus, you are giving a chemical.
Absolutely.
So if you when you use ascorbate powder, it is a natural form of vitamin C. So that is what is to be considered. But definitely it goes without saying that amla is very good, lime is very good, orange is all very good. And they should be part of the normal diet. At least they will prevent scurvy and its complications.
Very
But
nice.
you might remember that when we were studying, doing at least when I was doing my MBBS, in those days, all the doctors, all my teachers were prescribing vitamin C to patients for a cold, cough, any disease for that matter. Vitamin C was a must, was a part of a prescription, which no longer is these days. I
Correct.
don't see people with colds being prescribed vitamin C.
Yes.
It only came into being when COVID started. Then people started thinking about that. Prior to that, nobody is prescribing neither vitamin C nor even probiotics for people on antibiotics.
True, true. That's the real doctor. One of the doctors, Sahitya Pal, he is asking a question, doctor, that it's a wonderful session. Wheat, as you say, is the biggest culprit. I totally agree to it, but have doubts about rice. It is also a grain rich in starch. So, is it advisable to have rice instead of wheat? So, this is a question coming from Dr. Sahitya Pal. Your take on that, sir?
Okay, yes, definitely. I'd love to answer that question. Now, definitely, rice has a lot of starch, and rice having starch is rich in carbohydrates. When you take carbohydrates, the carbohydrates are going to increase your insulin resistance, and therefore they are harmful to you. That is one. Secondly, when you take rice, you're also along with it taking a lot of arsenic, because arsenic comes from the ground and water, groundwater, and rice requires a lot of water. Therefore, you're also taking arsenic. So, from that point of view, also rice is bad for you. Now, having said that, now the time when when we were eating rice, if you take the south for example, now in the north we were eating it as khichdi. Now, it's my understanding when you take it as khichdi, then the rice and the legumes which you are eating together, they balance each other out. So from that point of view, rice may not be as bad as I'm making out to be. In the south also, when you have rice, you have certain other things along with it which have always been eaten, which has always been there for the past thousands of years. So they tend to balance each other out. But please remember that rice definitely contains starch, therefore carbohydrates, and therefore it is definitely bad for you. Now, there is one way of taking starch which is known as resistant starch. You can convert the rice into a type of starch which is not harmful to you. And this again goes back to our forefathers and all that. This was eaten in the south earlier. I'm recommending it to my patients. What I tell them is you cook the rice. After cooking the rice, you if there's any water or starch in it, throw it away and put this rice in an earthen pot and cover it up to the top with drinking water. Cover it, leave it at room temperature for 24 hours. After that, by then the rice ferments. Throw the water away. And this fermented rice can then be had with curd. So this genesis of curd rice, as we eat in the south, is very sound. And this is resistant starch, and this starch is not harmful to you. In fact, it is very rich in B12 vitamins and certain other things also. So if you take this type of rice, it is not going to be harmful to you. This is what I'd like to say about rice.
So I think, Dr. Saab, that's a very interesting thing, bringing in curd rice, which in Tamil they call this as Tahir Sadam, you know. So I was, for a longer duration, close to 2 decades, I was in southern part of the country. So after every meal, curd rice
Yes,
is a must for them. It's kind of a ritual for them, right? So I think that
absolutely.
that is the context, that builds up, and which is very, very right.
Okay.
Dr. R.P. Singh, he is asking, sir, that what's possible composition of mixed millet flour or used separately? This comes from Dr. R.P. Singh.
Okay, I don't think it really matters. You may combine it, but as long as it is some sort of a millet, and if you like it, you can take any millet for that matter. But again, remember that if you are diabetic, then you are actually taking in carbs with them also, because they also contain the same, right? So in diabetics, I usually prescribe millets once their glycosylated has come to the pre-diabetic range. As long as they are rampant diabetic, like more than 6.4 glycosylated hemoglobin, I stop even millets also for them. Now, if a person has an autoimmune problem, then all grains have to stop. Wheat and all millets also have to be stopped. In that case, only coconut flour is what we recommend as per the standard protocol, and tapioca, and maybe one or two others. But usually the main grains are all stopped. So also milk and rice. So the
Oh,
composition does not really matter. It depends on how you want to have it. As at least as far as I'm concerned, I'm sure there would be people who may be able to mention more about that, but I don't know.
okay, okay. And Doctor, apart from that, you touched upon a very good quotation from Sri Ravi Shankar, So I think meditation and living a holistic and a calm mind, also plays a very, very critical role into that. So
Absolutely.
how do you see the integration of the meditation and the various other aspects into the bringing into the management of the holistic gut management?
See, the thing is that I'm touched upon, gut feelings, right?
Yeah, yeah.
Uh, every single feeling which we have in our body has something to do with our systems, all systems. Okay. So when you are cool and relaxed, then your gut is going to function much better. So mind has got to be involved in everything. Mind has got to be calmed down. And we are taking the cue from Ayurveda only. Ayurveda only tells us that eating starts from the time the food is being cooked, because the person who's cooking, that person love and affection is going into that. If the person is doing it with love, especially like a mother is doing that for the child, there's a lot of love is going into that. Along with that, if the mother has been doing some simran or bhajan or something, then that positivity is going into the food. I strongly believe in all this. When you're eating, then you're supposed to be thanking, which has been the tradition in Christianity as well, and I think all the faiths, they thank the Almighty for the food which they are going to get. Also, if you eat when you are angry, then the food is not going to sit well, because then your agni would have been increased too much. What you need is a balance of agni for the diet to be digested properly. So all of these factors play an important role. So if you meditate, then you're cool and calm, your parasympathetic system is working well, and that sits very well with your digestion, absorption, assimilation, and all that. I mentioned that food, which again has I've taken from Ayurveda only. That food does not mean only what you eat or drink. It means your thoughts, it means what you see, hear, whatever. All of that has got to be properly metabolized. Otherwise, it leads to mental harm. When mental harm takes place, it leads to anxiety, depression, and so many other complications. So I am basing all that on what Ayurveda has been teaching. Allopathy has not earlier been talking about that.
And I can draw certain lessons from a previous organization, right? So, Sri Ravi Shankar ji was a disciple of Maharishi Mahesh Yogi ji, right? So, Maharishi ji taught a technique, meditation technique called as transcendental meditation, so which I also practice, right? And it kind of helps. And that's why there's a lot of medical data on the table saying that irritable bowel syndrome, the genesis of it actually is a stress factor, right,
Right?
Dr. Saab? So I think maintaining a healthy mind rather than a healthy body, having muscles and all is equally important to live a healthy,
Yes.
healthy life.
I
Dr.
would go.
Vivek, sir,
I'm so
please, please,
sorry. I would
please, please,
go
please,
so
sir.
far as to say that no treatment is complete without a relaxed mind, unless all doctors must talk about that, and if they're going to talk about that, they must do it themselves first.
Absolutely.
So
That
when
is
you
the,
relax yourself, you can treat a patient much better.
so the doctor has to be first, relaxed, and
Absolutely.
telling to the patient.
You have to set examples. Again, this is from Ayurveda. Ayurveda
Yeah.
has taught us that the practitioner should try it on himself first and then see the effects and then prescribe to the patient. And those who have
But
been doing that have been very successful.
in times of today, it is opposite, doctor. For the patient bears the brunt, and then the later on the things set in set in the context, right? So
Well, I'm talking about the ideal situation.
yeah. So
Yeah.
Dr. Vivek Sharma, he asked that can we take Jawar Bajra? That's a
Yes,
question from Dr. Vivek Sharma.
we can do that. But again, in diabetics, long-standing diabetics, no. They have to start with coconut flour, get the diabetes reversed in type 2 diabetes. After that, you can come to this. Once your glycosylate has come to the pre-diabetic range.
Another question from Dr. As Ayurveda is that should diabetics completely avoid wheat and rice? Is that
Yes,
an ideal recommendation?
yes, yes. But resistant starch they can have. The rice, as I mentioned to you, that type of rice they can have.
Okay, okay, okay.
In fact, they
And
can even have raw bananas and raw papita also they can have because that also contains resistant starch.
okay, 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 okay. Doctor, we have a product called as Active Antacid and
Yes.
a brand called as Trifala also, right? Which is, I think, a very so how do you see Trifala being, in management of the gut? Because it has Amla, Harad, and Paheda, right? Which are very, very good for the management of the entire gut health, right? Right from the clean antioxidant properties, the cleansing properties, right? And maintaining a very movement of the gut, inside the bowel movement. So how do you see a very simple formulation called as Trifala from Ayurveda fitting into the management of the gut?
See, it will depend on two factors. One, if your gut health is good, right? In that case, you can give anything, it won't make much of a difference. If your gut health is bad, first you got to analyze what the factors are. If the gut bacteria are unhealthy bacteria you're housing in your gut, I mentioned that for removal, you can use Trifla. Trifla will definitely help, there's no doubt about that. But the point is that the other factors also must be taken into account. So if a person is eating refined food, he's taking a lot of sugar, he's eating wheat and rice and milk and all that, and you keep giving trifla, it may not be that effective. So you got to stop the things which are already toxic to the gut. You stop those, then you start building the gut. So in that, trifla definitely would play a role. That's the way I would like to put it.
Very
But
nice, very nice.
what people do is they may take a medicine thinking that they're going to be okay with it, but they do not stop what is harming them. So the result is not all that good. That is true for any medicine for that matter.
True, 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 doctor. And also, before we conclude, any suggestion for younger generation who's people like me? I like to count myself in the younger generation who are very busy, not able to exercise, have a proper holistic and a nutritious diet. Any words of advice how to maintain a healthy gut?
Well, my advice is be natural in all respects. Eat natural food. Natural food means what is grown on trees directly coming to you, what is grown from the earth coming to you directly, not if it has gone through some processing and all that. When it goes through processing, then every factor changes and that harms you. Similarly, use natural oils. For example, ghee. Ghee is very good for you. You must have adequate quantity of ghee or cold pressed coconut oil, cold pressed mustard oil, and of course extra virgin olive oil if you can have that. So have natural things to eat, natural thought processes, which means being happy, calm, cool, relaxed, and all that. Basic, this is what matters. And also, thirdly, do not eat in between meals. If you want to have 3 meals a day, ideal is of course 2 meals. If you have three, then have nothing in between. Have only the meals at the right time, as again Ayurveda recommends. You should have something in the morning, but your meal should finish before 2 p.m. Ideal is to have something around 11 or 12 o'clock because pitta is at its height at that time. And then evening, have an early dinner. So, early dinner, early lunch, If you want to have breakfast, have something healthy for breakfast. If you eat eggs, eggs are good for you, but eggs should be the brown eggs, the organic eggs, which have a yellow yolk along with the yolk. So eat healthy, think healthy, and exercise. That would, of course, be very good for you. Finally, meditation, if you can do that. At least do some way, something to relax yourself. But not go to alcohol and smoking and things like that to relax. No, they are not good for you at all.
True, true. So I think those are words of wisdom from you, Dr. Saab, with your long practice and exercise, and you being the example. Still, you're looking young and fit, right? So I think that's the best testimony. So I think with that, we'll wind up today's webinar, and I must thank Dr. Kohli for his time, his precious time, and kind of bringing various uh, domains into the management of gut. It was a wonderful session, and I think all the doctors, all the Vaidyas, all the people like me who are listening to the webinar will certainly be more enlightened, and will look to maintain the gut health in a much better way. With that, also I'd like to thank our digital partners, Dr. Piyush Juneja, for providing us a platform of indianvedas.com. And from the entire family of Dabur India Limited, I'd like to thank once again to each and everyone. Please keep following the webinars, posting the feedbacks. Dr. Piyush, are you there?
No, sir.
Okay. So with that, I think it's a time to say thank you so much. Stay healthy, stay safe, and as Dr. Kohli said, stay healthy, stay safe, think healthy, and eat healthy. With that, thank you so much. Wish you all a very happy and
Thank you, sir. Thank you.
thank
Thank
you so
you.
much.
Thank you very
Thank you,
much.
Dr.
I
Thank you.
enjoyed it.
Thank you. Thank you.